Hello and welcome to the short video series of Pharmacology by NEET. Today, in this first video of this series, we are going to discuss NSAIDs. Okay, so when I say NSAIDs or the non-steroidal anti-inflammatory drugs, these are the medications that help reduce inflammation, pain and fever. They achieve this by inhibiting the synthesis of the prostanoids, specifically if I say the prostaglandins. And these prostaglandins are produced by the enzymes known as COX or the cyclooxygenase. There are two important subtypes, COX-1 and COX-2 of these enzymes, but actually there are three subtypes including the recently discovered third subtype, that is COX-3. We'll be discussing about this later in brief. Now the COX-1 is basically a constitutive enzyme, meaning it's always active in the body and it plays important housekeeping roles such as maintaining the gastric mucosa, ensuring proper renal blood flow and aiding in the platelet production. For example, if I say prostaglandins that are produced by COX-1, they protect the stomach lining from the digestion and help keep kidney blood vessels dilated. Then we have COX-2, which is inducible. It means its activity increases in response to tissue injury or inflammation. The prostaglandins produced by COX-2 promote inflammation, pain, fever and inhibit the platelet aggregation during inflammatory states. Then we have the recently discovered, that is COX-3. It is a splice variant of COX-1 primarily expressed in the brain. Its exact function is not fully understood, but it is thought to be involved in the central nervous system processes and may be targeted by certain analgesic like paracetamol, that is the acetaminophen, right? Different NSAIDs target these enzymes differently, and here we will try and understand and correlate it to the classification of NSAIDs, though we'll be discussing classification in the next part of the video. There are certain NSAIDs, those will be acting on both the enzyme COX-1 and COX-2, although they have more or less affinity for any of these enzymes. For example, if I say aspirin, it mainly inhibits COX-1 but also affects COX-2. It's used at low doses for its anti-platelet effect in cardiovascular disease prevention. Then we have another example, that is ibuprofen, or we can also say the naproxen. They inhibit both COX-1 and COX-2 to almost similar extent, and these all drugs are known as the non-selective COX inhibitors. There are drugs that have more affinity towards COX-2 enzymes than the COX-1 enzymes and hence are known as the preferential COX-2 inhibitors. These are the drugs like diclofenac and aceclofenac. COX-2 selective inhibitors are also there, which are known as the COXIBs. They specifically inhibit COX-2, making them effective anti-inflammatory, analgesic and antipyretic agents, and they have lower risk of gastrointestinal side effect because they do not inhibit the COX-1. However, these drugs have potential side effects. Inhibiting COX-1 can impair gastric mucosal protection, increasing the risk of ulcers and bleeding, and can affect renal perfusion as well, and it is generally occur in the renal disease individuals. Inhibition of platelet production, as with aspirin, is beneficial in preventing blood clots but can also increase bleeding risk. So when I say COXIBs, by selectively inhibiting COX-2 reduce inflammation but may increase the risk of the cardiovascular events because they can promote platelet aggregation. Therefore, the choice of NSAIDs depend on the clinical scenario. You have to balance the benefits with the risk as well. Before we deal with the detailed classification of NSAIDs, I want you to understand actions of different prostaglandins or important organs or the important organ systems, so that your concepts are clear how we have to deal with these prostaglandins and make a conceptual decision while prescribing the NSAIDs, because as dentists we are dealing with these drugs a lot, right? So if we try to understand the mechanism of the prostaglandin formation, what happens whenever there is trauma? The membrane phospholipids are there, which are acted upon by an enzyme called phospholipase A2, which is a rate limiting enzyme, and this releases arachidonic acid. Now this arachidonic acid is converted by COX enzymes, COX-1 and COX-2. COX-1 always active, maintains housekeeping function as we have discussed, and COX-2 is inducible, active during tissue injuries or inflammation, and these are going to produce the prostaglandin H2. Now this prostaglandin H2 is converted by specific enzymes into the prostaglandins and thromboxanes. Now the prostaglandins which are involved in the inflammation, pain, fever, gastric protection, renal function, all these are going to be affected, and we should be discussing their function individually. So